Dr. Jay Bhattacharya, friend of the show, professor from Stanford University Medical School. He's a physician, epidemiologist, health economist, and public health policy expert focusing on infectious diseases and vulnerable populations. He was also one of the co-authors of the Great Barrington Declaration, which describes an alternative approach to COVID policies called focused protection that sought to protect the most vulnerable while avoiding or minimizing the societal harm of COVID-19 lockdowns. Welcome back to the show, Dr. Jay Bhattacharya.
Thank you for having me on, Jimmy. Appreciate it.
Now, when you called it the Great Barrington, now, is it because you guys have big egos? You call it the Great Barrington Declaration? It couldn't have just been the Barrington Declaration. Hey, why don't we call it the fantastically amazing Barrington Declaration?
You know, I thought of the name of it because we signed it in Great Barrington, Massachusetts, where I'd never been before, never heard of the place. But as soon as I heard of the place, I'm like, we have to call the declaration Great Barrington Declaration, because you won't be able to tell if it's the name of the place or if it's about the declaration being great, which is both.
That's exactly the type of thing I would do. Well, the reason why we have you on today is because there is this, I want to give you a chance to respond to this column in the Los Angeles Times, and it would personally singled you out and smeared you, and it's by this guy named Michael Hiltzik. Hiltzik.
Oh, he's got a face for lockdowns.
He's got it out. So now we did a little research on the guy. We'll give you it later, but the guy's a total tool, right? And he's got a lot of sketchy things in his past, but this is one of my favorites. His column, Trump is plotting a vaccine debacle for November and people will die. And then, of course, he comes back, column, mocking anti-vaxxers' deaths is ghoulish, yes, but necessary.
Look at that face while you think about it.
So that's who wrote this, but the LA Times printed it. So that's why we are. And by the way, they gave him, he won a Pulitzer for something he wrote.
His book, Ghoulish but Necessary.
But as we found out with the Russiagate, the Durham report completely debunked Russiagate even more than the Mueller report did, which means it was all made up by the Clinton campaign and the FBI. And they still get to keep the Pulitzers that they won for writing about Russiagate as if it was real. So I guess whatever he got that. So what happens is every year they have to give out awards. And so people just get them. As Richard Jeni said when he got the Comedians Award, he said, awards are like venereal diseases. Nobody deserves them, but if you fuck around long enough, you're bound to get one. And so he got one of the venereal diseases right there. So here, we're going to go into, I want to go into a little bit of this article, and almost every paragraph is crazily funny and ridiculous and so easy to debunk. I could do it, but I have the expert with us, so he could do it. So I just want to show, he starts off by saying, they're a cadre of academics and scientists. So the headline is, by the way, these experts sold the United States on a disastrous COVID plan and never paid a professional price. Well, first of all, go ahead, Kurt. You know what the problem is.
We didn't go with
didn't go with their plan.
We locked down, Jimmy. We locked down. We closed schools. We did everything this guy wanted in California, anyways.
Well, it's already a comedy. It's like reads like a comedy piece.
Can I give you the punchline?
Yes.
You know what the all-cause excess deaths in Florida versus California through the pandemic? Age-adjusted all-cause excess deaths. Guess which is high? Which has had more deaths?
I would say California.
You're right. Right. Florida did not follow. They followed more closely like my plan, and they had less deaths than California. California followed this guy's idea of a good plan.
Well, the United States followed this guy's idea of a good plan, and we have way more deaths than other countries that didn't.
He's a respected business columnist.
By the way, why on earth is a business columnist writing an article that tries to debunk medical professionals, the leading medical professionals in their field? Why? You know why. He's being paid. That's why he's being paid. So let's start with this. He says that they're a cadre of academics and scientists who pushed a discredited solution. Well, we'll never. First of all, it's not discredited. He's talking about the Great Barrington Declaration. Declaration. And second of all, we will never know if it would have worked because they didn't implement it. So who pushed the discredited solution to the COVID pandemic, shunning masks? We now know that masks at the population level do nothing. They never do. And by the way, we knew that before the pandemic.
I didn't know that. I thought that they were.
The funny thing is that we had Sweden actually implement something like the Great Barrington Declaration.
That's right. They did.
They're like, basically almost the lowest in all the world.
So Sweden didn't lock down. They didn't close their schools. They didn't have mandatory anything. And exactly what you just said, the proof is in the pudding, is that they had lower deaths than the United States per capita and one of the lowest in their region, right?
Well, I hope you pay a price for that, Jay.
I guess fine. Give me a. Could I get a Pulitzer? Do they give that to academics?
You should, yeah. So you guys shunned masks, school closings, even vaccines.
Now, that's actually not true. Like, if you read the Great Barrington Declaration, we say vaccines can be part of the solution. Like, for older people, and you and I have talked about this, I thought the vaccines are a good idea for older people for risk-benefit reasons.
Just like an influenza vaccine is important for older people because older people die from the flu all the time.
Yeah, well, I mean, I think the thing is like the vaccines, the mandates were the problem. Like forcing people to get it, not giving informed consent, that was the problem.
Yes, that was always the problem we had with it. We would always tell people, once we figured out early here on this show, because we had Dr. Robert Malone on in mid-2021, and we figured out through our own observations that the countries with the highest uptake of the vaccine would sometimes also have the highest outbreaks of COVID. And so we started to put the pieces together, and Dr. Robert Malone informed us that you can't vaccinate your way out of a pandemic like that. And trying to do so was actually a bad idea. Yeah. And that of course, that doesn't mean that the vaccine isn't fantastic, safe and effective, and will keep you from a serious injury, death, or hospitalization. But, and I have to say that. So back to this. They say, so they keep going back to that you were pushing herd immunity, says all in the name of reaching the elusive goal of herd immunity, resulting in what may have been hundreds of thousands of unnecessary American deaths. What may have been? Well, he doesn't know. He's just making that up. And by the way, we implemented your plan, the guy who wrote this, and we had the highest death rate in the world. So
yeah, it's crazy. This is okay. So first of all, it's fine. He's a business columnist. If he was taking my graduate, he'd have trouble in my graduate classes in like statistics and stuff. But so he gets it wrong early. Fine. But this is really late in the pandemic. He doesn't know that like those lockdowns failed and herd immunity. This one. Okay, this drives me crazy, right? So you're landing an airplane, Jimmy, right? You're a pilot. Do you follow a gravity strategy?
I don't know.
There's just gravity is there. Like herd immunity is just there. You're going to land the airplane either safely or unsafely. Gravity is just there. Herd immunity is there. Lockdowns are a herd immunity strategy. Eventually, everybody got infected.
And they always knew that, by the way, that everyone would always get infected. In fact, in June of 2021, Andy Slavitt, the head of the COVID response for Joe Biden, tweeted out during Delta that Delta was so infectious and contagious that everyone was going to get it. So that's when I knew then. So in June of 2021, I knew that mandating vaccines had no scientific basis whatsoever, and that you shouldn't do it on a scientific basis, not only a moral and ethical basis, because it wasn't informed consent. But I couldn't get anybody to listen to me. I'm like, the guy, it's not me saying it. It's Joe Biden, czar on COVID, is saying so people with your masks and your distancing and your locking downs and the vaccine never was even tested to see if it stopped transmission or contraction. And so how is it that I knew this in June of 2021, and here it is now almost June of 2023, and this guy writing a column for the LA Times still doesn't know this stuff.
I'll tell you that here's the problem. You were listening to fringe experts, weren't you?
And so the people who, by the way, all the mainstream experts like Dr. Fauci, Collins, Walensky, They were all lying constantly, and they were wrong about everything at every turn. Not only they lied about where the virus originated. They said you were a white supremacist and a racist if you said it came from the Wuhan lab, which we now know it did. So that's the jumping off point. And we know that Fauci lied about that the first scientist there said that it was most likely came from the lab. He gave those guys a $7 million grant. Boom, overnight they switched their opinion. And then we caught him getting people to write smear pieces on anybody who said different than Fauci about anything. And Fauci lied about masks. Fauci himself wouldn't stop talking about herd immunity. He lied about herd immunity 3 times on television that I saw. And he admitted to lying. They had said, hey, why did you say we needed to get 50% of people vaccinated to get to herd immunity? And now you're saying 60 to 70% of the population. And he said, well, it's probably around 80, but I just didn't think the country was ready to hear that yet. So I was waiting to see when they were ready to hear the truth. And then he told them the truth. Isn't that amazing? So he lied for months and months about herd immunity. Who did Fauci? How do I know? He admitted it. I was like,
on herd immunity, especially with the vaccine, you have a vaccine that doesn't stop you from getting infected. That means it doesn't stop you from spreading the disease. That's right. That means it doesn't. If it contributes to herd immunity, it only does so for a very short time. It's ridiculous. He basically didn't know that the vaccine stopped transmission, and then he made the leap to say, "Oh, you absolutely have to get 80% of the population vaccinated to get herd immunity." That's not scientifically right.
Well, first of all, he did know that it didn't stop transmission because it was in the data that they hid. They wanted to hide for 75 years. You're telling me Dr. Fauci and the FDA, they gave the okay to an experimental drug without looking at the vaccine trial data? Of course they looked at it. Of course they knew they were lying when they said that.
I mean, it's just shocking. It's just shocking.
You know what's shocking? This guy wrote an article, science doesn't move at warp speed.
Oh, that's when Trump was president? Because Trump was trying to get a vaccine.
You can't just rush your vaccine, Trump. You're going to kill people.
Yeah, so that's him. That's him doing this. That's him trying to scare people about Trump's vaccine. But then then as soon as Biden was president, everybody else was an anti-vaxxer. Isn't that amazing? He's the biggest anti-vaxxer in the world, and then somebody else is bad as soon. And nobody's supposed to remember that. By the way, nobody does remember that. That's why we bring it up to what kind of a moron that guy is. So this is him. We haven't even gotten into the meat of this article yet. That's the contention of We Want Them Infected, a painstakingly documented new book by Jonathan Howard, a neurologist at New York University and a veteran debunker of the pseudoscience contaminating our efforts to fight the pandemic. This guy call you up when he was writing that book, Dr. Bhattacharya? No, he didn't call you up. But that's weird that he would write a book about something you wrote and talk about you extensively, but he wouldn't interview you about it and give you a quote in his book. That doesn't sound like journalism or anything that's even on the up and up, does it?
This guy's been obsessed with me the whole pandemic. He just writes like he doesn't understand basic epidemiology, and he doesn't understand the harms of the lockdown. There's a lot of people. Tony Fauci did this. I had bigger fish to fry than Jonathan Howard.
Okay.
So yeah, I mean, I think this is one of these things where there's a lot of people who got the whole pandemic wrong. They got herd immunity wrong. They got the harms of the lockdown wrong. They got the vaccine mandates wrong. They got a bunch of things wrong. And this is like sour grapes. Like now they're trying to pretend like they
did it.
Right?
We shouldn't have gone with your system, Jay.
We shouldn't have went with your system, Jay. Gosh,
we should have locked the whole thing down. We should
have had lockdowns. We should
still be locked down. If this guy had his way, that's what we have. We'd still be locked down.
I know.
Like China didn't do it right? Even China gave up on zero COVID, and these guys haven't.
So he goes on. Howard takes his title from Paul Alexander. The title "We Want Them Infected." So Paul Alexander was a Trump advisor, and he said that it comes from something that he said during the Trump administration, talking about letting the virus spread to the healthy. The idea was that so many people would eventually become naturally infected with the virus and therefore immune from further infection that the virus would be unable to spread further. Infants, kids, teens, young people, young adults, middle-aged, with no conditions, etc., have zero to little risk, he told the Health and Human Services officials. So we use them to develop herd ... We want them infected. So he was saying if you get people who are almost at zero risk to the virus infected, that will help us towards herd immunity. Is that true? Because it sounds like it makes sense, right?
I mean, it's true. I mean, I guess I wouldn't have said it this way because I don't want anybody infected.
Okay.
The problem is we don't have a technology to stop people from being infected.
But everybody's going to get infected. They always knew that.
Yeah,
What if I wear a mask, though?
Well, I'm not going to go recommend COVID parties, right? It's crazy. It's nuts, right? But because that's not what. But letting kids play with other kids, I'm in favor of that, Jimmy. I don't know about you. I mean, I'm in favor of not putting masks on 2-year-olds because I'm sure that'll stop the disease. It's not like making people infected to say let kids play with kids and let the kids have school. That's just letting kids have school.
So he goes on. Alexander's proposal was essentially a screed against lockdowns that suited the Trump White House, which was searching for a way around the economic dislocations caused by the virus. But he was wrong about the toll of sickness and death that would result, allowing the virus to rage among these ostensibly low-risk groups, and wrong about the prospects of reaching herd immunity. He's acting as if they implemented the Great Barrington Declaration instead of lockdowns. We implemented lockdowns and vaccine mandates.
Trump pushed the lockdowns.
Trump pushed the lockdown. Trump pushed the lockdowns and the vaccine.
Hey, wait, you don't think this guy is just doing this on purpose, do you?
The book is populated by quacks, mountebanks, and charlatans. I don't even know what
you, sir, are a mountebank and a charlatan.
And not a few scholars with distinguished academic records, I guess that's you, many of whom appear to have been seduced by the embrace of right-wing echo chamber in promoting unproven and disproved policies.
Disproved? Wait, it never happened.
Never happened.
Unproven. I mean, this is the Great Barrington. Okay, I'll tell you a secret. That Great Barrington Declaration, I like it. In fact, I love it. But the problem is, it's as old as the hills. It's the least original thing I've ever written my entire life. It's the standard pandemic plan we followed for a century, and it worked. It worked in 1957. It worked in 1968. It worked in 1976. It worked for President Obama in 2009.
It's okay. I know. So let me just get through because there's more. I really want to show what a clown the LA Times decided to give their paper to. He says, it's unbelievable that while doctors like myself were working to treat sick COVID patients, begging people to stay at home and be safe, there was another group of doctors working at cross currents to us, prominent doctors wanting to purposely infect unvaccinated young people with the promise that herd immunity would arrive in a couple of months. They consistently minimize the gravity of the pandemic, but rarely, if ever, acknowledged that their optimistic forecasts of illness and death were consistently proven wrong. They were consistently proven right. If anybody was proven wrong, it was the establishment, Fauci, that made the virus seem way deadlier than it actually was. In fact, for children without a serious medical condition, the danger of severe COVID is so low as to be difficult to quantify. The risk of long COVID among children, a source of fear among many parents, is also very low. That comes from the New York frickin' Times, and that came from them in 2021. According to the CDC, among the children, the mortality risk for COVID-19 is actually lower than from the flu. That's according to the CDC. So this guy writing this wants you to think that children were really afraid and everybody was super, super at risk from this virus when they weren't at all. And in fact, now we know a new study from the leading doctor in the world on this stuff says that the infection fatality rate in 2020, that's before we had the vaccine, was less than 0.1%. So 99.9% of people who got COVID before the vaccine, 99.9% of them who were under 70 had a survival rate. Sounds very much like the flu. Go ahead, Dr.
John Ioannidis is my colleague, and he's the most highly cited scientist in the world. Most cited living scientist. But I'll tell you, there's a punchline which is not in this headline. You know who published that article? John that you just cited? The Bulletin of the World Health Organization.
Ah, you're kidding. So the WHO published that.
Yeah.
So, and just to let so that should debunk the LA Times moron who wrote this. But in case he doesn't read well, because it doesn't appear he does, I'll give him audio. Here's Bill Gates confirming what we're saying.
It wasn't until early February when I was in a meeting that experts at the foundation said, there's no way, there's been too much travel without diagnosis for us to contain this.
So he's pretending that the reason why they weren't able to contain the virus wasn't because the vaccine never stopped transmission or contraction, but because there was too many people traveling. So he didn't want to, he hadn't cashed out his stock yet on the vaccine yet. He was about to. And so
is that from when is that? What is he talking about? 2020 or 2021?
I think he's talking about 2021. I think. Okay, so, but here we go. Now here's the next thing he says that completely debunks this whole article.
And then at that point, we didn't really understand the fatality rate. We didn't understand that it's a fairly low fatality rate and that it's a disease mainly of the elderly, kind of like flu is, although a bit different than that.
So now is Bill Gates an anti-vaxxer, moron, quack also? Because that guy who wrote this article would say so. So this was Gates in May of 2022. That's what this is from.
I think he's talking about 2020 though. So, and what that means that even in 2020, he knew that it was low risk. February 2020, he knew it was low risk to children. I knew it was low risk to children in February 2020. It was really clear from the Diamond Princess data. It was really clear from the Chinese data and from the Italian data that was coming out then that it was that was based. I mean, I breathed a huge sigh of relief when I saw it. I have 3 kids. I was really, really happy that there were much low, basically negligible risk. I mean, I don't care if I die as much as I care about my kids die. So like for me, that was like a big deal.
So he goes on to, this article goes on to say there was a problem with the herd immunity theory, saying your theory. One is that immunity from, first of all, that was Fauci's theory. Fauci said we had to give the herd immunity through vaccines. That was it was his idea.
Basic biology. It's like gravity. There's like, you're just like trying to say, oh, there's no such thing as gravity. What is this? Like, I would give this guy an F on his term paper if he's turned this in.
So he says that one of the problems with herd immunity is that immunity from COVID infection tends to wane over time rather than becoming permanent. Also, infection with one variant of the virus doesn't necessarily confer immunity for other variants, of which there have been many. Another problem is that COVID can be a devastating disease for victims at any age. Now, look at the mealy-mouthed language. Can be. Is it? No. But it can. If you're a 2-year-old with cancer and you get COVID, it might be bad for you. It can be. But is it? No, the statistics say that it's not. The actual statistics and the evidence that we have say it's not a devastating disease for victims of any age. In fact, it says the exact opposite, exactly what Bill Gates just said, and he said that a year ago. Bill Gates said that a year ago, that it's an infection mainly of the elderly, kind of like the flu, but a bit different of that. It has a low fatality rate. In fact, we know if you're under 70, the fatality rate, 0.1%.
It's actually 0.05 in John's article.
Okay, allowing anyone to become infected can expose them to serious health problems. Moreover, the prospect that COVID could be defeated by the natural expansion of herd immunity persuaded many people not to bother with proven countermeasures, including social distancing, masking, and vaccination. None of those things were proven. None of those things. He just made up that. You know where they got social distancing from, Kurt? You know this. Yes. They just made it up.
Business leaders bargained it down from 10 to 6.
They wanted 10 feet, and then business leaders were like, no, and they brought it down to 6 feet. And masking, they completely made up. They never had evidence that showed masking works, and now we have evidence that shows that it makes no difference at the population level. And vaccinations, well, how could we have...
I got vaccinated, and I also still got COVID. What are you talking to?
What are you talking about? We all got COVID. We all got vaccinated, and we all got COVID.
He forgot to put goggles and plastic plexiglass shields everywhere on the list.
Yeah,
those will stop the COVID.
Plexiglass. I still sometimes walk into a hotel. They'll have a plexiglass shield that's just like 2 feet high. Like you think the air?
Let's put. You know what? Just to be safe, let's put sand in those skate parks again. That'll stop the COVID.
So in his book, Howard reserves his deepest scorn for the promoters of the Great Barrington Declaration, a manifesto for herd immunity published in October 2020 and signed initially by epidemiologist Jay Bhattacharya, that's you, Martin Kulldorff had him on the show from Harvard, and Sunatra Gupta of Oxford, three really fringe out there universities, really nutsos. And then he says, in parentheses, thousands of other academics and scientists would later add their signatures. Thousands. All of them crazy.
There was a Nobel Prize winner that signed on.
Yes, there was. The core of that's what made Fauci get them to write smear articles about you and the Great Barrington Declaration, because he got nervous that now a Nobel Prize winner had already signed on to this. We got to shut it down. The core of the declaration was opposition to lockdowns, which you turned out to be right about. Lockdowns had negative effect, meaning they created more damage than they stopped. Correct, Doctor?
Yeah. I mean, just to give one data point, the UN said that the economic harm from lockdowns would throw 130 million people around the world into dire food insecurity, which is their way of saying it was going to starve people. 130 million people.
That's right. We reported that on this show. And then he goes on to just start smearing you guys because he doesn't like, apparently, the politics he projects onto you. He says its solution was what its drafters called focus protection, which meant allowing those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection, while better protecting those who are at the highest risks. That's what we should have did, but we didn't do it because we would have had better outcomes, way better outcomes.
40% of the deaths in California were in nursing homes. How well did we protect our elderly in California? 80% of the deaths are over 65. I mean, we did not protect our elderly.
The average age of death from COVID is 82 years old. Focus protection. By the way, that's over the age of life expectancy in the United States. So we all locked down for a virus that the average age of death was over the age of life expectancy. You go ahead, try to put that somewhere that makes sense to you. Focus protection, the promoters wrote, would allow society to achieve herd immunity and return to normalcy in 3 to 6 months. As Howard documents in that stupid book, the declaration was little more than a libertarian fantasy. Oh my God, libertarian fantasy from an arch-libertarian, Jeffrey Tucker. I automatically hate anyone libertarian.
And arch-libertarians, even worse libertarians.
They call this guy. So they say that this whole thing that you wrote came from an arch-libertarian named Jeffrey Tucker. That's the big smear of the piece.
Where you want liberty?
I mean, Tucker was the guy that like allowed us to have this our conference there at this place in Great Barrington, Massachusetts. I like Jeffrey, but I don't share his politics. I mean, frankly, I've been very careful about saying what my politics are because I'm in public health. I'm supposed to reach everybody, left, right, arch libertarian. Even I'm supposed to reach people like Hiltzik. In that sense, I guess I failed. But I'm not an arch libertarian. It's ridiculous to say I'm in favor of like aggressive measures to protect vulnerable older people. I'm in favor of like alleviating poverty, where it's, I'm in favor. I mean, it's ridiculous.
Well, they said that you never specified how to achieve your goals in the Great Barrington Declaration. Delivering food and supplies to millions of housebound seniors. In a Hoover Institute interview, Bhattacharya said, we could have offered free DoorDash to older people. As Howard observed, he says that as if that's crazy.
Yeah, arch-libertarian would definitely say that, right?
Right? I know. As Howard observes, Bhattacharya was remarkably sanguine about creating a program overnight to deliver fresh food to tens of millions of seniors for months on end throughout the entire country. Well, I don't know if he knows this, but they actually did create a program that did bring food to seniors, because I know a guy who runs a restaurant who made more money during COVID servicing seniors paid for by the government that gave them 3 meals a day, millions of seniors across the country. So they already had a program to do this.
Yeah,
I think
is he against the program? Like, what is he saying
He-
here?
are you
Saying
against
it's
meals?
a pie in the sky.
He's saying it's pie in the sky to think that we could actually feed and take care of our elderly population during a pandemic. No,
Jimmy,
we can
$6
do
trillion
it.
buys a lot of DoorDash, I got to say. I mean, come on.
You're being very sanguine.
It wasn't that's just not realistic, your plan, Jay, to take care of the elderly. How about a realistic plan like shutting the entire world economy down for a great reset? not this crazy targeted crap.
Shut it down. Shut the whole thing down.
Shut the whole thing down. Similar hand-waving addressed the problems of multi-generational households in which millions of vulnerable elders live. So he's saying that your idea to have targeted PROCUS protection on elderly people wouldn't work because there's multi-generational households. Well, there's multi-generational households even if you don't do the Great Barrington Declaration. If you do 100% lockdowns, there's still multi-generational. This is such stupid pablum that I'm high and I'm able to do this. I'm able to debunk this. This is a second grader couldn't write something this stupid.
I say it's hand waving, Jimmy.
Older family members, the Declaration authors wrote, might temporarily be able to live with an older friend or sibling with whom they can self-isolate together during the... We already do this. If you have an elderly person, you don't go around them if you have the flu. You don't go around them if you have a cold. We already do this stuff, and we could have told them to wear an N95 mask if you have to go around old people. We were locking down people. People were isolating already. What the hell are they talking about? As if everybody was isolating, not just old people. And how well did that work?
I mean, this is the thing. It's like he doesn't understand how a lot of people live in this country, right? So like there are poor people in this country that have multi-generational homes. Why not make hotel rooms available? Johnny calls grandma, says, Grandma, I've been exposed to the virus. Grandma calls public health. Public health says, okay, here's a hotel room for a couple of days until you figure out if Johnny's positive or not. Is he really against that? Like, why is that a bad thing? I just don't understand it.
The governor of California said he was going to make every hotel room available to the homeless during COVID. Was that also? So he calls what you wanted to do the single greatest logistical challenge humanity had ever undertaken. That's what this author of the book says about the Great Barrington Declaration, but doing even more. Even locking down, closing schools, pouring sand into playgrounds and skate parks, arresting surfers at the beach, all that stuff.
Setting up intelligence to spy on people who didn't like it.
That's right. All that. That wasn't the single logistic, but doing less was somehow the greatest single legit. Like this, it doesn't make sense. It's contradictory to itself.
Well, you're going to have to pay for your mistakes, I say.
One of the things, like one of the reasons why so many older people died is because we basically didn't really prioritize. Like, why did Andrew Cuomo send COVID-infected patients to nursing homes? It's because it's expert like these who are telling him, "Oh, you got to protect hospitals," instead of saying, "Why not protect older people?" That's who's really. We protected hospital systems over protecting vulnerable people because of experts like these.
What the Declaration, meaning your declaration, really promoted was complacency, Dr. Bhattacharya. Its drafters were people with no real world responsibility for much of anything who made impossible things sound very easy. Again, the thing we actually did was a way heavier lift than what the Great Barrington Declaration. Isn't it? They make it seem the task of actually getting food into the houses of elderly people was left up to public health authorities who were understaffed, overwhelmed, and underfunded. We did that anyway. We locked down old people anyway. We locked down everybody. What? Go ahead.
What did they want from us? Like, they wanted me to deliver myself the food like, we spent $6 trillion on public health in this emergency. What is he talking about? Understaffed. I mean, the question is, what do you focus on?
That's right.
The problem is they focused on keeping kids out of school instead of focusing on protecting older people.
Now here's you think it can't get dumber?
Oh, boy.
Do you think this article can't? I'm sorry I'm spending so much time on this article, but it is the dumbest article I've ever read, and I've been doing a show since I started on KPFK in 2009. This is the dumbest article I've ever read in my life. It was like it was written by Cenk Uygur about the Ukraine war or something. So what may be the most inexcusable element of the herd immunity movement was its implication that children could be used as shields for the rest of the population. Its advocates counseled against vaccinating young children on the grounds that their susceptibility to the virus was minimal or even non-existent, so they could safely acquire immunity naturally. And perhaps, as Vinny Prasad of the University of California, San Francisco implied, provided immunity boost to adults and their families.
My God.
That is all 100%. He's pretending like what he's writing there isn't true. It is true.
You're using children as vaccines.
Your children were at, I already showed you at the top of this that according to the CDC, the mortality risk from COVID-19 lower than from the flu. That was from the CDC in 2021, and this guy is still writing this garbage in May of 2023. Let's get back to it. He says, so they're saying that you're putting children at risk. Yet, although children tended to suffer less from symptoms when they were infected, they were anything but immune. Watch this. According to the Centers for Disease Control and Prevention, more than 1,600 American children under the age of 18 have died from COVID during the pandemic. That's okay. So the CDC may have said that. Did they die from COVID or did they have cancer and died with COVID?
I believe
because the fatality rate for children with COVID less than from the flu. So he's trying to scare you about a virus that is less lethal than the flu. That's what he's doing. He wanted us to I don't know, I guess we did it what he wanted, to lock down because we could protect children who were not at risk from it. What?
Is this the same one we looked at where they said children up to age 21 or something? Like they raised the age of children?
That's right. But that was for a myocarditis.
Oh, right. Okay.
But the thing about this is like, it's tragic when children die. I mean, even unhealthy children dying is a tragic thing. How do you prevent this? Like, what do? You stop them from going to school? You put them in a bubble? Like every kid is a bubble boy? I mean, it's crazy. Like, we had 1 in 4 young adults seriously consider suicide because of these lockdowns and the social isolation. We have like children who don't know how to read now because we closed schools for a year and a half. The biggest driver of inequality for any social policy I've ever seen is these school closures that we did. It's poor and minority kids that have suffered the most, and they will suffer worse health through their entire life as a consequence. And this guy's just like, he's like trying to say, oh, it's a tragedy that children die. Yeah, I think it's a tragedy that children die. How are we to prevent that?
Well, we didn't do your system either. These ones died during the way he wanted.
All the schools were locked down. All the kids had to wear masks. Everybody had to get vaccinated, and all those kids still died. We didn't do your thing. They're pretending like we did.
I mean, that's the thing. I don't understand. Like, what exactly does he want? Like, this is a really highly infectious disease,
and everybody and kids are going to catch it. And I advocated here at this show that children should not be vaccinated, that the risk was greater than the benefit, and it's been proven that that's true. And although the vaccine is safe and effective, and will
slow down infection rates of the hospitals by people who are sick.
That's right. So he goes on to say that for doctors to counsel deliberately exposing children to COVID when a vaccine is available, especially if the purpose is to protect adults, is a moral abomination. Well, I don't think anybody was advocating for deliberately exposing children. That's not what you were doing, right, Doctor?
No, we're arguing for having school.
We're having school.
I mean, how radical is that? And there's, it actually has health consequences for children. Like there was a paper in 2020 by the editor of JAMA Pediatrics, just a fringe expert, who estimated that closing schools for even a short time in spring of 2020 would cost American children 5.5 million life years. Because if you close schools for a while, children, they're less well educated, they lead poorer lives, they lead less healthy lives, and they lead shorter lives. We cost our children 5.5 million life years just from the spring 2020 school closures.
And there's still people advocating for lockdowns right now. You know this.
Let's face it, too. America's kids weren't geniuses before that.
They couldn't really afford it. So here's my favorite part. So here we finally get, it's a corporate big pharma funded newspaper. Of course we're going to get to where they want to censor. Of course it is. So in a world guided by science, the promoters of an unsuccessful herd immunity theory would long ago have lost their credibility and their public soapboxes, as opposed to the people who promoted the successful.
That's what this is about. This is another like Taylor Lorenz libs of TikTok, and yet they're still available.
They're still, yeah.
Why I haven't? That's all that it is. That the whole point of this.
The whole point of this is to get to this. The opposite has happened. Bhattacharya and Kulldorff still have their platforms. Kulldorff is now associated with the right-wing Hillsdale College.
Oh.
Both were appointed in December by Florida's anti-vaccine governor, Ron DeSantis, to a public health integrity committee charged with questioning federal public health policies.
DeSantis is not anti-vax. That's a lie.
Did he tell you not to say gay? Answer the question. Right?
Gay. Kulldorff. Martin is still on leave from Harvard.
So I just want to, just so you know about the guy who wrote that.
Who can't believe you have a platform.
Who can't believe that you, Dr. Jay Bhattacharya, who turned out to be right about COVID, and it's like he wrote this article in 2021.
Your views caused no damage because we didn't
do them.
Follow anything that you wrote.
We didn't follow anything that you wrote.
Deplatform him.
That's right. But this guy who wrote this, Michael Hiltzik, he still has his platform at the LA Times after his many ethical challenges. What would that be, Jimmy? Well, like in 1993, when he was a correspondent for the Los Angeles Times in Moscow, he was caught hacking into his colleagues' email messages, and he was recalled from the bureau.
Yeah, they said his sting, his own boss there suspected him. They did some sting and caught him, but
it couldn't be 1993. I don't think we had email in 1993.
Yeah, they were starting to use email back then.
Oh, really? Oh, okay.
So this is like the first of people using email.
Really?
So I imagine reporters would do a lot, and he was like, "Oh, I can spy on my colleague." It's like when Dave Weigel had a pro-war march in college kind of guy. This is this guy.
He also, in 2006, he was suspended because of his sock puppet accounts where he would praise himself and have long-standing feuds.
Yeah, maybe we didn't cover that story, but
no.
I remember hearing about it when it happened.
Yeah.
This guy's connected to somebody because he's still there after all these like embarrassments.
I have many sock puppet accounts. Luckily, I don't have a job that I could be fired from for having
I should have thought of that for the Great Barrington Declaration. That would have I could have had a lot more positive press out of it.
Yes. I have at least 5 sock puppet, and it's normally to respond to people who are lying about me who have blocked me, right? So that's the big reason.
This is on his blog. He goes in the comments of his own blog to fight with the people commenting on it.
He was also criticized in January for a January 10th, 2022 column where he encouraged the public humiliation of unvaccinated people who died from COVID-19.
Remember that? We covered this.
Yep. The Los Angeles Times is receiving blowback for a column published Monday that was headlined "Mocking Anti-Vaxxers, COVID Deaths is ghoulish, yes, but many be necessary." So they got in trouble for that, but they're still printing his bullshit. Why do you think they're still printing this bullshit? Why? Because they're being paid to print this by Big Pharma and probably a couple other organizations.
I mean, the thing of him like ease off Monsanto. Who would write an ease off Monsanto article? That's not like a lizard.
So he just goes on. The anti-vaccine movement has spotted an opportunity to sow doubt. They say that we may be on the verge of a public health disaster because of what you did. What? Well, again, we didn't follow his thing. And the people who are anti-vax now, it's because they didn't like what the COVID-19 vax, what was promised, that and it didn't amount to what they were promised.
Yeah, I mean, that's the problem with the anti-vax movement is that it's like the CDC and people like this that essentially have elevated the anti-vax movement to the sky. Like, you had people saying if you get the vaccine, you can't, COVID vaccine, you can't get sick, you can't transmit the disease. Well, they were wrong.
And they were
so now
lying.
all of a sudden, everybody, they were lying. And as a result, now people think they're lying about everything.
Because they are. Everything I looked into around COVID, doctor, they were lying. They were lying about where the virus came from. They were lying about funding it. They were lying about herd immunity. They were lying about natural immunity. They were lying about masks. They were lying about transmission. They were lying about contraction. They were lying about the adverse events. There's 1 in 800 adverse events from this. Go ahead.
I agree with you about all of that. But the thing is, there are things public health doesn't lie about, right? Smoking is bad for you, causes lung cancer. Or if you get the measles vaccine is a good thing for kids to get, right? So those things are not lies. But people now are going to think they're lies because no one trusts public health because public health lied about all these things on COVID. That's the source of this distrust. It's because public health misrepresented true facts. And of course, normal people will say, well, these guys are supposed to be telling me true things. And they told me false things. And they took away my job because I didn't want the vaccine. And they took away a year and a half of my kid. And now my kid can't read when he's in 7th grade or second grade. It's just one of these things where of course you mistrust people that lied to you that you previously trusted. That's the reason why you're seeing this public health disaster he's talking about.
The public health disaster was created by the lies of the CDC and the FDA and people like Dr. Fauci and Walensky who lied repeatedly. And not only repeatedly on CNN, but to Congress. I've at least 3 times have Fauci lying to Congress, but of course he'll never be prosecuted for lying to Congress because he lied at the behest of the big pharma bought establishment. That's why he was allowed to have his job for 40 years and in the federal government, making $400,000, $500,000, $600,000 a year, the highest paid ever in the government. Why? Because he was doing the bidding of big pharma and the military-industrial complex at the same time. He was ahead of the bioweapons thing, and he was making sure that big pharma's agenda got instituted, not only through the government, but through universities and research centers all around the country that he controlled the funds to.
Now the new NIH director, who was funded by?
Bill Gates?
No, Pfizer.
Of course.
Millions of dollars.
So now they have this new, I wish I had time to talk to you about this, but they have this the WHO, there's a new treaty that governments are going to start signing where we all have to acquiesce to the WHO. If they say that there's a pandemic, there is, and whatever they say goes, like locking down or mandating vaccines or vaccine passports or all that stuff. And they're funded primarily by Bill Gates. So it's basically one billionaire who's running our international health policy now, and he's got enough money to corrupt the governments of those places too. So that's if you saw everything that happened during COVID happened because of that. Because a handful of billionaires, one of them's Bill Gates, can control things like the WHO and the entire Congress. That's how much money and the news media. We've already showed you that Bill Gates, to the tunes of $400 million, has bought the media. Right? It doesn't take much. Anyway, so Dr. Jay Bhattacharya, I'm glad that you came on. I hope you appreciate this opportunity to respond to such an obvious tool like Michael Sitzlitz, whatever his name was.
I don't know.
His name
Shitlibs.
Michael Shitlibs. I don't know what.
If it wasn't the LA Times, it's one of these things where I would just ignore it. But it's bad for public health that people like this have a platform, and to say that people who are right should pay a professional price. There's a lot of irony there.
And here he is being an anti-vaxxer and then hating anti-vax. It's just whatever which way the political wins or whatever which way his paycheck is being paid. That's what a guy like Michael Hiltzik is going to say. He doesn't have integrity or a point of view. He's just going to repeat whatever he's being paid to say.
You mentioned the Monsanto. I looked this up. He wrote 2 articles in 2018 and 2019 when some poor guy got cancer from being exposed to this Monsanto Roundup product. Got a jury verdict for a bunch of money because they got cancer. He wrote an article defending Monsanto, which gave these guys cancer.
Yeah, that's right. So and then they have to also buy him a Pulitzer, so that when he's doing the bidding of people like Monsanto and Pfizer, that he has a little credibility. They go, look, he's got an award that we also paid for.
Think what kind of a piece of shit you'd have to be to, when email was first invented, you were one of the first people to spy on your coworker's email.
Yeah, that's the kind of people who work at the LA Times. I know it hurts your feelings extra hard that it was the LA Times, but they're one of the worst. They were the ones first to hire Ken Delinian, and it was revealed that he was working for the CIA hand in glove when he was reporting on stuff for the LA Times. And then he moved on. Now he's at NBC News. Then there's never a price to pay for being caught lying and working with the people you're supposed to be exposing. That's what the corporate media is being funded by the people they're supposed to be investigating and exposing. So of course they're never going to do any good news, and it's left to idiots like me to do it. And I'm glad to do it. It's not too hard. It's not hard to do it. All you have to do is follow the money, and you'll know exactly what everything that happened.
I still don't get what that whole article was. I'm still like,
that whole article was pretending as if we implemented the Great Barrington Declaration, and we didn't. All the results they were pointing to were results from their approach, not from the Great Barrington Declaration approach.
Like if you're trying to put it on people that said don't go to Iraq, how Iraq turned out. Yeah, it felt like that.
It felt like that. It's like, oh, you didn't want us to go to Iraq? Well, look at all the people who died in Iraq. I hope you're happy.
You still have a platform?
And you still have a platform.
That's exactly what's happened. I mean, that's exactly what all the anti-war folks in 2003. That's their blame for what the Middle East is like now. It's all their fault.
That's what they're doing. That's exactly what this article is. It's a rewriting of history, and as George Orwell taught us, that's what they do. That's what the establishment does. They rewrite the past and they own the future. And so now it's all gobbledygook. What is it called? Newspeak?
Yeah.
Yeah. Anyway, Dr. Jay
Doublespeak?
Yeah, doublespeak.
Doublethink.
And doublethink and newspeak. Yeah. Anyway, Doctor, and it's fun to watch guys like you become awakened to the corrupting effects of money in public health. But it's also like someone like Dr. John Campbell, who does a YouTube series, which is really fantastic. He also had got red pilled, or whatever they say the kids are saying today, about what happened with the corporate influence of money in public health, into where it's completely corrupted all the agencies and all the Western world, for sure, including the WHO, the FDA, the CDC, and their equivalents in the UK. It's fun to watch him. He's very chagrined. They're like, oh, really? You can't trust anything in medicine. And no, you can't. You can't even trust the Lancet. You always have to see who funded that. Who funded that study? Because that means more than anything. Anything you'd like to add to this before we say goodbye?
No, I'm really grateful to you for the opportunity to respond, because it's just frustrating to read this kind of stuff. We're like, what we were trying to do is we were trying to help people. We're trying to help vulnerable people. That was the motivation.
I know. Well, you're a monster.
In places that actually use the strategy, like Florida did better than places that didn't, like California,
and
Sweden.
Yeah. Yes.
All that ultra libertarian Sweden, where they use the strategy.
Oh, those right wingers over in Sweden, huh? Okay. All right, Dr. Jay Bhattacharya, it's always great to talk to you. I appreciate you making time for us.
Take care, Jimmy.
Okay.
Thanks so much.
Hey, everybody, check out my new stand-up special, COVID Lies Are Funny, only $10. And come see us live in Syracuse, Cohoes, New York, Hartford, Los Angeles, Bakersfield, Baltimore, San Francisco, Huntington Beach, and more, Pottstown even. Go to jimmydore.com for a list of all of our things, and see you there.